Yeah. So, yeah, there you are. Yes, you can start now.
Okay, sir. How can I address you?
Yeah, you can call me Lincoln, Abraham Lincoln, and I'm 18 years old, and I am basketball player.
Good morning. I am Dr. Keval.
Uh, right. Yes, good morning, doctor.
Yes. So after examining you, your symptoms are pretty much consistent with the diagnosis of meniscus tear. But however, before proceeding further, can you describe what exactly happened with you, Abraham?
Yeah, actually, I have a problem. Severe pain, sudden severe pain in the at the front of my knee during practice.
Okay.
I applied an ice pack and I was driven to the surgery, by my coach. Yes, that's what it happened, and I am with you. My knee is swelling and it's becoming very painful, especially if I try to walk or if I put on weight on that one, if I stand or, yeah, just if I try to put on weight, okay, like that. I am facing that problem. I have been experiencing this pain in my knee for the last few days, especially when I run or play sport. Big problem I have. And I'm a sportsman. I cannot be away from these things. I don't remember injuring myself, though my knee has been making a clicking or a popping sound, and sometimes it locks also. And I want to play on the weekend.
All right. I am sorry to hear that you are facing all this. However, the diagnosis, you have been diagnosed with meniscus tear in the knee. So may I know what do you know about this condition?
Yeah, I don't know anything, doctor. I really don't know anything.
Do not worry, I am here to answer you all your questions. So the meniscus tear happens in the knee when there are sudden twisting or rotatory forces in the knee. Like as you already said that you are a basketball player, so it involves sudden jerks and some motions in the knee. And when these motions are happening suddenly, this type of tear can happen. So the meniscus is generally a cartilage around the knee, and basically it has stone at the moment. Are you trying to understand me?
Yeah, of course. Of course, I am trying to understand, but still I'm not 100% sure whether I understood or not. But the thing is, I don't mind all these things. What matters to me the most is I have to play at the weekend, and by that time I should be ready. And even now, I want a faster recovery. So, what am I going to do? I think the problem is just a growing pain. So, that's all.
Yeah, I understand your concern. I appreciate your concerns. So first of all, we can discuss some immediate treatment that you can incorporate at the moment. It is known as riser regimen. So in this riser, it stands for resting, applying ice to the affected area, also providing compression, proper compression, and elevating the knee. And one more thing, what I can do is I am going to provide you a referral to the physiotherapist. And also I will prescribe you some pain medication. However, the pain medication will not be effective. You are also going to need a physiotherapist at the moment, as he is the specialized person who can provide you an appropriate exercise plan, also some strategies which will help you to recover faster, and some specific treatments. So I hope you are able to understand me.
Yeah, of course, doctor. That's very clear. And the doctor, I want you to fix me, so that I will be able to play in the competition this weekend. Promise me, doctor, do something. I want a faster recovery.
I can understand that you are quite anxious and frustrated at the moment that you want to play, but I want to make one thing clear to you that at the moment, until the recovery has not been achieved in your knee, you cannot play in the next week. Also, I want to explain you that if you fail to comply with my suggestions, your condition will be detrimental, and the meniscus tear will further aggravate, and also you might need an immediate surgery. So I'm afraid you cannot participate in the next week. I'm sorry to say that.
This is not fair. And I don't think this is injustice. I come to you with great trust, and you can say I cannot. This is my life. It depends on this competition, doctor. And why don't you give a spray to numb the pain for painkillers, and give something? I want to participate, doctor. This is not fine.
Yes, I am here to listen to you and work with you. However, first of all, the most appropriate thing at the moment is me referring you to a physiotherapist, and you comply with his suggestions. Also, I'm providing you a pain medication, but it will not be enough to provide you the exact pain relief that you are aiming at the moment. So, in my experience, it is better that you undergo a referral to the physiotherapist and comply with his suggestions. If you don't mind, I can contact him on your behalf and arrange an appointment so that you can achieve your recovery as soon as possible. Is that clear?
Yeah,
I hope you would be able to do all these things, and I hope I was able to answer all your questions and address all your concerns, Abraham.
yeah, that's a fine, doctor. Yeah, and then I want to tell you, doctor, that I want to recover quickly because I know I'm young and I'm fit and I can get a faster recovery. Why don't you try, doctor, please, please?
Yes, definitely. Your concerns are appreciable and you are quite young. So yeah, you will recover faster. So it will all happen once you start following the treatment regimen and visit a physiotherapist on my recommendation. So everything will work out as per your suggestion. Is that fine with you? I hope
Yeah,
you're able to do that.
of course, doctor. But I want you to do. I want to play at the weekend. But I don't know what you are doing with me. Okay, fine. If nothing is possible, I'll listen to you. But the thing is, as far as possible, try to push me out, doctor. I want to participate.
Sure, I am here to work you in every step of the way. So just follow my suggestions and you will be fit and fine in no time.
Okay, doctor. Thank you very much.
Thank you. Take care.
Right. Okay. Right. That's a good role play, and you have done a good job. Yes, you have done a good job. I am very pleased with your presentation. You have done it excellently well. There is no doubt regarding that. But what I want to ask you is, yeah, right. What I want to ask you, what I want to tell you is, now when you are speaking, I'm giving you some points here, feedback. You're dragging the ending sounds, and but then like that, the end sounds. Control then and, but no pulling it. That's not fine. And then there are some pauses and breaks, something like, and in that after, like that breaking everywhere, every 2 3 words you're, you have to be careful regarding that one. So that fluency has to be maintained. You are fluent, no doubt you are fluent, but sometimes you're doing that one. I don't want you to speak very fast. I don't want you to speak very fast, but at the same time you should not be very slow also. You should maintain a strike between both the ends, negative side and positive, at least average you have to be. So sometimes you're speaking very fast, sometimes you're speaking very slow, cutting it off, so that you have to manage. And so main thing is dragging the ending sounds whenever you don't know what to do. That's a problem. So better start wisely. The next one is you're overusing the conjunctions. I feel you're overusing the conjunctions. Now, what is this overusing the conjunctions? When I say you're overusing but, however, together you are using but and however. Any one you use, ne? But is there. Then what is the use of however? Don't overuse. Actually, but is equal to however. Do you know that? And you are using them alongside one another. So avoid this, duplicating. If it is necessary, yeah, I agree, you have to use them, no doubt regarding, but at the same time, you have to be careful. Okay. Now I said, but at the same time. At the same time is different, but is different. So you can use like that, but simultaneously means at the same time. So you can use like that. Alternate different ones you can use, but not the same meaning. So that is the what is hitting you hard. And then the flow is well maintained, quality sentences you are using, the fluency is excellent, the vocabulary is also fine, no doubt regarding that one. But control that overusing of vocabulary, especially the conjunctions or connectors and other things. The next one, you have to be little bit pleasant. You're just like duty bound officer, military person you are attacking. No, you have to be soft spoken, gentle speaking. You're gentle, kindness. Okay, kindness should be there. You should keep like that. What I tell you is you should present that kindness. The other person should feel that kindness in your words. That kindness I cannot say. As of all, I want to speak this finish this speaking. I want to tell him. I want to give more information. This is there, but that is secondary. First of all, without that love, intent is prior to content. Intent is prior to content. So what is this intent? Intent is to make the other person happy. Intent is to make the other person um, you know uh, convinced. Intent is made to make the other person peaceful, calm, relaxed, comfortable. But instead, your goal is to deliver the goods. Your goal, your target is to speak as much as you can. Your goal is to prove that you are an excellent doctor. Your goal is to prove that you want to get good marks. This is secondary. This is secondary. First, intent is prior to content. Many people say, he told me like this, he told me like this. Now, here, what is the intent behind that one? They don't judge, they're fast. Okay, the patient also is a normal human being. He cannot judge your content. He will say, doctor said, no, don't use that medication. You're telling because it's not good. But where is the intent? The other person should feel, yeah, doctor told me. See, how many times I'm repeating, I don't want a doctor, I don't want doctor. Still, you're going on telling the same thing. Why don't you understand that you have to pacify me before me? I should agree with you, no, first of all. You should put me into your pocket, then only I will agree with you. Then otherwise I'm repeating the same thing. I want to go for. Why don't you tell in the first instance only and clear it off? Why don't you tell it in the first instance and clear it off? You could have told in the beginning itself. According to this present condition, okay, it will take at least 2 weeks for you to heal totally. In case if you ignore the importance of treatment and participate in the sport, the condition may deteriorate further and may not be in a position to get back, regain normalcy. So you can talk like these things, right? If you give proper time, at least 2 weeks for your knee to heal, you can be able to participate after that because it is totally healed. Now, otherwise, it is a problem. And in this situation, still you continue, the condition will definitely deteriorate and it will be beyond measure. And repairing this thing is, it will take a tough time. It's a hard task. So, better prevention. So next, you can also say like this. I absolutely agree with you. If I were in your position, I would have also felt the same. And this definitely being an athlete, this competition is of most is a most valuable episode in your life. And if you can prove, then you can be a star, a national star or district star or international star, whatever it is. And this is the most prized. But remember, nothing is more important than your personal health. If your health is right, everything is right. Okay. Do you think keeping the condition of your knee like this, going and participating with this, partial strength, with this knee which has partial strength, not complete strength, can you participate to the fullest and prove that you are an excellent athlete? Definitely no. In order to participate in the athletics, what you have to do is you have to have full, okay, vigor and vitality, and you should 100% perfect, because the competitors are 100% perfect, and they will definitely outsmart you, they will outwit you, they will outrun you, because you are not 100% fit. There are less chances of you of winning in the with this condition. Trust me, I too want you. You are my patient. You are my. You are under my observation, and I am your doctor. Because of that, I want you also to participate, and I will feel very happy if I can send you. But on the contrary, but on the contrary, see here, on the contrary means but only, but means on the contrary. So anyone you have to use. I remember you are using duplicating. That's what it is. So, but my sincere suggestion is to refrain from participating. Okay, before 1 week, okay, before 2, 3 days, if you are ready, then I will send you. But don't over stress your knee. If you are fine, if you improve your health, then definitely you can participate in the next round of games. But now, I recommend you to avoid because it matters your health. Maybe you, if anything goes wrong, and you may not participate even in the future. That should not happen. To avoid unwanted complications in the future, unforeseen complications in the future, it is better to refrain with a steely heart. Yeah. Is that clear, Dr. Keval Shah? Unmute.
Yes, sir.
Okay. Anything you want to ask me, you can ask your doubts or questions or whatever you want to tell.
No, sir, it's clear. Everything is clear.
Yeah. So your speaking is done. Right. So next, number 3. Who is number 3? Jaya Lakshmi. Regular students who wants, you can message in WhatsApp. Jaya Lakshmi, Grishma, regular students. Purnika. Yeah, regular students, you can message. Sadiat, message me on WhatsApp. Message me on WhatsApp. Yeah, Jaya Lakshmi, you are the next speaker. Yeah. Jaya Lakshmi, yes. You are the next speaker. So you have the speaking cards there. So Jayalakshmi, Grishma, next Grishma. After Jayalakshmi, next Grishma. Number 3 is Jayalakshmi. Jayalakshmi. Number 4 is Grishma. Remember. So here we are. Yeah. So pin. So we have finished speaking sessions so far. Number one was Yashodhara. Yashodhara Vijay Sundara. Nursing finished. That was number one. Number two, Keval Shah. Keval Shah medicine. Yeah, that is done. Number three is Jaya Lakshmi. Number three is Jaya Lakshmi. Nursing. Yeah, which card you want to do, Jaya Lakshmi? Yeah, Jaya Lakshmi. Yeah. So you have the cards there. Okay. Yeah. Yeah. Grishma has sent one. Next, number four is Grishma. Number four, Grishma. Grishma Shankaram. Nursing. Grishma Shankaram Nursing. Yeah. So Jaya Lakshmi, be ready. Jaya Lakshmi, be ready. And your card is here. So the card is here. Yeah. Which card you want to do, Jaya Lakshmi, in this? Number one, unmute Jaya Lakshmi. Jaya Lakshmi, unmute. Yeah, Jaya
Sir, good
Lakshmi,
morning, sir.
good morning. Which card you want to do? Number one or two or three or four? Which card is that?
Yeah, this one I'll do, sir.
This one you will do. So insulin injections. Yeah, get ready. Prepare for 3 minutes. Yeah. This is the card for you.